Welcome back, everyone, to the Deep Dive. Today, we're going to be really taking a deep look at how CBT, cognitive behavioral therapy, can be used with older adults. We've got a ton of really interesting material to get through, research, clinical insights, and really just trying to understand why it's such a powerful tool.
Yeah. And I think it's particularly relevant when you think about just the wider context of how societies are changing around the world.
Absolutely.
We're not just living longer, we're seeing like a fundamental shift in the structure of, populations. If you look at Europe, the US, even countries like Italy, Bulgaria, the Czech Republic, all seeing this kind of real steep climb in the ratio of older people to younger people.
Yeah, you see that reflected in that aging index we were talking about before. It
Exactly.
really is increasing a lot in a relatively short amount of time.
For Europe, it's almost a doubling projected by 2030. So it's not just like, oh, a few more people are getting older. It's really like, whoa, hold on. We need to think about the support that's going to be needed.
Right. And then there's the dependency ratio that increases as that aging index increases.
Yeah, absolutely.
That's the number of people over the typical retirement age compared to the working age population. In Europe, again, a huge projected jump from like 29% to 51% in that same period.
And that really puts a strain on everything. You think about healthcare systems, family structures, all of that is challenged when you have this kind of shift.
Yeah, and we have to remember people are living longer, especially in places like the UK, where life expectancy has gone up something like 20 years just since the early 1900s. That means those later years need attention too.
It's about adding life to years, right? Not just years to life.
Okay, so we've been saying older adults, but who are we really talking about here? Is it just like anyone over 65?
Yeah. It's a good question. I mean, 65 is kind of the common benchmark, but it really is more than just a number, isn't it?
Right.
I think when we talk about older individuals, we have to look at biological health, their psychological state, what's going on socially, not just like, oh, well, their birth certificate says this.
Like that saying age is just a number.
Yeah, exactly. It's important not to make assumptions just based on age, and I think that's something therapists working with older adults really have to be sensitive to.
That each person is an individual.
Absolutely.
And I imagine their social connections, or lack thereof, make a big difference too.
Oh, huge. And it's not just about whether someone's in contact with family or friends, it's the quality of those relationships, right? Are they supportive? Are they strained? That all feeds into the bigger picture.
Okay, so let's talk about why CBT is especially relevant when we're talking about older adults.
Mm.
Sometimes there's this, I don't know, image of old age as kind of this time of decline. Is that really true?
I think there's this perception out there that it's all downhill after a certain age.
Uh,
But honestly, the picture is way more complex and thankfully more positive than that.
okay.
We are living longer, that's true. But what's also true is that we're generally healthier for longer.
Ah, interesting.
Think about the leading causes of death. Back in the day, it was things like infections. Now it's more chronic illnesses, heart disease, cancer, stroke, things like that.
Okay.
And what that means is that, yeah, people might be managing ongoing health conditions, but they're doing it for longer periods and, importantly, while still living active lives.
And speaking of these chronic conditions, the whole idea of disability is something we need to talk about. And the WHO, the World Health Organization, has this framework for understanding it, which is interesting. So where does CBT fit into all of this?
Yeah, so the WHO model basically helps us tease apart the different aspects of disability. There's the actual physical impairment itself,
Right.
and then there's the limitations and activities that stem from that, and ultimately the impact on someone's ability to participate fully in life.
Makes sense.
But here's the thing, and this is where it gets really interesting. Often, the level of disability someone experiences goes beyond what their physical condition alone would suggest.
Hmm.
It's like there's this excess disability driven by psychological factors.
Ah, I see.
Think about someone with arthritis. Maybe it's not even that severe, but they're so afraid of pain that they stop going to social gatherings.
Right.
That leads to isolation, which then impacts their mood. It's a vicious cycle.
So it's not just the physical limitations, it's the mental and emotional response to them.
Exactly. And that's where CBT is so effective. It helps people tackle those psychological barriers to maximize their independence, even when there are genuine physical challenges. And, even when there's this kind of like, understandable sadness related to those challenges, CBT can help people find ways to improve their quality of life.
Really important to understand it's not about pretending the physical stuff isn't there.
Exactly.
Okay, let's talk about something a bit more difficult now. We were looking at some statistics earlier about suicide rates. And it was pretty startling,
Yeah, it's a tough reality to confront. We're living longer, but we're also seeing a higher risk of suicide in older adults.
and particularly in men.
Yeah, especially men. For women, even though they often face a lot of hardship, their suicide rates are actually lower than men in the same age group. And there's this whole other layer, which is that suicide in older adults is probably underreported, so the true scale of the problem might be even bigger than we realize.
That's a real call to action, isn't it?
Yeah.
We need to be doing more to support mental health in later life.
Absolutely.
Okay, so let's address something that some listeners might be wondering. Can therapies like CBT truly help older adults who are dealing with serious physical health issues? It might seem like talking about thoughts and feelings is almost secondary when someone is facing those kinds of challenges.
It's a totally valid question, right? You might think, well, what good is talking when someone's struggling with a physical condition? But the evidence really shows that psychosocial treatments, and CBT in particular, can have a major positive impact on late-life depression.
That's good to hear.
Much more so than just doing nothing or getting a placebo. When we look at cognitive therapy specifically, it consistently comes out as an effective treatment for depression in older adults. There was one analysis that showed that people who got treatment were actually better off than like 74% of those who didn't. That's huge.
That is big.
And another interesting finding is that for this age group, individual therapy seems to be more effective than group approaches. So the idea that psychological help is somehow less important when there's physical illness just doesn't hold up.
Right. It's all connected. And you mentioned some key researchers, Thompson and Gallagher-Thompson, who've done a lot of work in this area. Right?
Yeah, they've been pioneers, really. They did all these systematic investigations into how to apply CBT specifically to late-life depression. And they even developed really detailed treatment manuals that are still valuable resources today.
That's great. So CBT can be effective, we know that.
Yeah.
But how do you adapt this model to the unique experiences and challenges of older adults? Seems like there's a lot more to consider when you're putting together a treatment plan.
Absolutely. You can't just take a one-size-fits-all approach. When you're working with older adults, there's so much going on, right? You've got potential medical conditions to think about, major life changes like retirement or bereavement, and often these complex intergenerational family dynamics.
Right.
So the way we think about this is through the concept of formulation.
Yep.
It's about moving away from this kind of, I don't know, like simplistic loss deficit view of aging, which unfortunately has been pretty common in the past.
Oh, really?
Yeah, but it's really about focusing on the individual's specific circumstances, their strength, their challenges, and creating a really personalized roadmap for therapy.
So, okay, formulation is this key idea. But what are the actual areas that a therapist would assess when working with an older adult? Like, where do you even start?
So there's this model, the cognitive model for older people, sometimes called CMOP for short, and it really highlights these key areas.
Okay.
So first off, you got the physical health. You need to understand that fully. Then there's this concept of role investments, which is basically about the roles someone holds in their life and how those contribute to their identity and sense of self-worth.
Interesting.
We also look at intergenerational linkages, which is just a fancy way of saying relationships with different generations in the family. And then finally, there's the sociocultural context, which is everything from, societal attitudes towards aging to the shared beliefs of someone's generation.
Wow, so many layers.
It's complex, but it's really important to consider all of these factors because they all interact and influence someone's mental well-being.
Okay, let's talk more about role investment because that seems particularly relevant as people go through things like retirement or changes in their family roles.
Yeah, it's about how much significance someone puts on the different roles they have in their lives. And what's interesting is that research suggests that if someone's too invested in just a few roles, they actually may be more vulnerable to depression if those roles are threatened or lost.
That makes sense. Like if your whole identity is tied up in your career, retirement could be really difficult.
Exactly. And we also see these kind of gendered patterns, where women often find a lot of self-worth in their relationships, while men tend to focus more on achievements at work or in other areas.
That's fascinating.
And as people age, those key roles can change or disappear altogether. So think about things like widowhood, retirement, children moving away. All these transitions can have a big impact.
And you have to understand those experiences to provide the right support.
Absolutely.
And intergenerational linkages, you mentioned that before.
Yeah.
It seems like more than just having family contact.
Yeah, exactly. Family relationships can be amazing. They can be a source of so much strength, but they can also be incredibly stressful.
For sure.
You have these different values, expectations between generations. Think about how older adults might value interdependence, while younger generations might emphasize independence.
Right. Or just different views on life choices.
Exactly. And those differences can lead to conflict, misunderstandings. It's not just about this simplistic generation gap idea. We need to really understand the specific dynamics playing out in each family.
To see how they're impacting mental health.
Exactly.
Okay, let's talk about how CBT is used specifically for late-life depressive disorders. You mentioned before that feeling down can be pretty common, but how do you tell the difference between that and clinical depression that needs professional help?
Yeah, that's a really crucial distinction. It's normal to feel sadness or grief after life changes. That's just part of being human. But clinical depression is different, it's more persistent, it's more intense, and it really impacts your ability to function in daily life.
Okay, so how do you recognize it?
There's actually a lot of debate in the field about whether the standard criteria for diagnosing depression really capture the experience of older adults. Sometimes depression might look different in later life. You might not see the classic intense sadness.
Hmm.
Instead, you might see more apathy, fatigue, or just a lack of motivation. And that can be tricky because it can be easy to dismiss those symptoms as just part of getting old.
Oh, I see. It's not just that they're sad, it's that they've lost interest in life.
Exactly. And that's why careful assessment is so crucial.
So are there specific symptoms that clinicians should be looking out for in older adults?
Yeah, so you're looking for a cluster of symptoms, not just one thing in isolation. Emotionally, you might see sadness, of course, but also irritability or loss of interest in things they used to enjoy. Cognitively, you might see problems with concentration, memory issues that aren't due to cognitive decline, feelings of hopelessness or worthlessness.
Okay, and what about physically?
Older adults with depression might have fatigue, changes in appetite or sleep, or just these vague physical complaints. And then behaviorally, you might see them withdrawing from social activities, being less active overall, or even neglecting their personal care.
It's like a whole person picture.
Exactly. And the key is that these symptoms are a change from their usual selves, and they're causing distress or impacting their ability to function.
And you mentioned earlier that you have to be careful not to jump to conclusions based on certain outward signs.
Yeah, absolutely. You always have to do a thorough assessment and rule out any physical causes. So, for example, if someone has a stooped posture, it could be osteoporosis, not necessarily depression.
Right.
Or if they look disheveled, it might be because they're physically struggling to take care of themselves. And things like bowel changes, slow movements, confusion, those can all have medical causes. So you can't just assume it's depression without looking at the whole picture.
Makes sense. You have to be really thorough. Okay, let's talk about what the actual process of CBT for late life depression looks like. What happens in those first few sessions?
Well, the early sessions are really about laying the groundwork. It's about building a strong therapeutic relationship.
Right, that's always important.
Trust is crucial. And it's also about explaining what CBT is, how it works, because a lot of people might not be familiar with it.
Yeah, it's not just sitting and talking about your problems, is it?
Right. So we explain that it's about actively working together, identifying and changing unhelpful thoughts and behaviors.
And the therapist is more like a guide.
Exactly. We're not just passive listeners, we're actively collaborating, teaching skills.
And is there a set time frame?
Yeah, typically CBT is time limited, so we clarify that from the start, manage those expectations.
Okay, what about the middle phase of therapy? What kinds of skills are people learning?
So this is where the rubber meets the road, so to speak. We're teaching coping skills in three main areas: managing thoughts, understanding and regulating emotions, and making behavioral changes.
This is really practical.
Absolutely. And we're constantly monitoring how things are going, keeping track of progress. The goal is to empower the patient to become their own therapist, give them the tools to manage things on their own.
Right, that makes sense. And is the order of those skills important? Like, do you start with thoughts, then behavior, or the other way around?
Well, it depends. If someone's dealing with severe depression, we might start with behavioral techniques first, like getting them engaged in enjoyable activities, and then later move on to tackling negative thoughts with things like thought records.
Okay, so tailoring it to the individual.
Exactly.
You shared that story about the musician who was struggling with feelings of worthlessness.
Yeah.
Can you tell us more about that? It seemed like a really good example of that collaborative, problem-solving approach.
Yeah, so this was a 75-year-old guy who had retired and was really struggling. He felt like he was worthless now that he wasn't working, and, just telling him that his thoughts were wrong, it wasn't going to cut it.
Of course not.
So what the therapist did was she asked him, okay, what kind of evidence would actually make you question that belief? And he eventually said, well, if these two other musicians I really respect, if they gave me positive feedback, that might make me think differently. So they came up with this plan. He was going to reach out to them and get specific feedback using clear criteria. And guess what? The feedback was overwhelmingly positive.
Oh, wow.
It directly challenged his whole belief system. And that's the power of CBT, right? It's not just about telling people what to think. It's about helping them find the evidence themselves.
Yeah, that's a much more powerful approach.
Yeah.
And you mentioned before that it can be frustrating for therapists when beliefs feel really entrenched. Like, how do you deal with that?
Oh, it's totally normal to feel frustrated sometimes, especially when it seems like someone's really stuck. But the important thing is to be aware of your own biases, right?
Oh, right, like ageism.
Exactly. If you're coming in with preconceived notions about older adults, that's going to get in the way.
Yeah, you have to check yourself.
Absolutely. And the key is to stay optimistic, keep that problem-solving mindset. Just like we help patients challenge their negative thoughts, we have to do the same for ourselves.
Right, lead by example. Okay, so we've talked about the beginning and the middle of therapy. What about those last few sessions, that final phase? What's the focus then?
So the late phase is all about wrapping things up and preparing for the future. Ideally, by this point, the patient has made significant progress. We start spacing out sessions, giving them more time to practice their skills independently.
Okay, like a gradual stepping back.
Exactly. And that also helps to highlight any remaining issues that need attention. We also spend a lot of time on relapse prevention.
So they don't fall back into old patterns.
Right. We review everything they've learned, identify potential triggers for future difficulties, and develop strategies to manage those situations.
That's great. Okay, let's shift gears a bit and talk about some specific behavioral techniques that are important in CBT. You've already mentioned the importance of increasing activity levels. Why is that such a key part of treating depression?
So there's this whole model of depression, the behavioral model, which is really central to CBT. And it basically says that there's a strong link between what we do and how we feel.
Okay, like actions influence mood.
Exactly. And when there are disruptions in life, those can lead to a decrease in positive experiences or an increase in negative ones. And that can really contribute to depression.
And I imagine that risk of disruption is even higher for older adults who are going through all sorts of changes.
Absolutely. Retirement, loss of loved ones, physical limitations, all these things can throw you off balance. And for many older adults, a lot of their positive reinforcement comes from their social connections, the roles they play in their families and communities.
Makes sense.
So when those are disrupted, it can be really tough. And depression often leads to withdrawing from activities, which then makes you feel even worse, and so on. It's a vicious cycle.
Right, like that downward spiral you were talking about before.
Exactly.
So it seems like the goal is to break that cycle by encouraging people to be more active.
Exactly. So in CBT, we use specific behavioral techniques to help people increase their engagement in things that they find pleasurable or that give them a sense of accomplishment.
Okay, so what does that look like in practice?
Even something as simple as scheduling one enjoyable activity each day can make a big difference.
Wow, that's encouraging. It doesn't have to be some big production.
Not at all. It could be reading, gardening, listening to music, spending time with a friend, whatever brings them joy. We know that older adults, especially after retirement, can become more sedentary, and that can be detrimental.
Right.
So we work with them to identify those pleasant events, or PEs, and we actually schedule them in. It's about being intentional.
That's a great idea. And how do you figure out what those pleasant events are?
Well, we often start with what's called a weekly activity schedule, or WAS. It's basically a way to get a baseline of what someone's already doing. And then later on, we can use it to track not just the activities, but how they feel during and after those activities.
Oh, interesting. So you're tracking their mood along with the activity?
Exactly. And that helps them see the connection, right? That their actions can directly influence how they feel. We also work together to come up with a list of things they used to enjoy or might enjoy now, even if they're not doing them currently. And then we often create a top 10 list of those PEs, things that are relatively easy to do and likely to have a positive impact.
Okay, so it's about finding those things that spark joy and then actually making time for them.
Exactly.
And you also mentioned problem solving as an important behavioral technique. What does that involve?
So problem solving is this very structured approach to dealing with specific difficulties. And it's not just about, venting or complaining. It's about taking action.
Okay.
It's a step-by-step process. First, you clearly define the problem, make it specific and manageable. Then you brainstorm all sorts of potential solutions, no judgment at this stage. Just get as many ideas down as possible.
Okay, so it's like brainstorming.
Exactly. Then you evaluate those solutions, think about which ones are most realistic, most likely to work. You pick one to try, make a plan, think about potential obstacles, and then you put it into action. And afterwards, you evaluate how it went.
It's like a little experiment.
It is. And the key is that it gives people a sense of agency, right? They're not just stuck, they're taking steps to solve their problems.
That's empowering. And you talked about relaxation techniques for managing anxiety. Things like progressive muscle relaxation.
Yeah, so PMR is this technique where you go through different muscle groups in your body, tensing and releasing them.
Okay.
And it helps you become more aware of tension and relaxation so you can consciously relax those muscles when you're feeling anxious.
Interesting.
The therapist usually demonstrates it first and then the patient practices, often with recordings. An attention diary can be useful for tracking anxiety triggers and how it shows up physically, but we have to be mindful that PMR might not be appropriate for everyone.
Right, especially if someone has physical limitations.
Exactly. So for them, we might use guided imagery, or there's this really simple breathing technique, diaphragmatic breathing, which is basically slow, deep breaths from your diaphragm. That can be really calming.
Okay, so there are different options depending on the person.
Exactly.
All these behavioral techniques are about taking action. Now let's talk about the cognitive side of CBT and how it addresses those negative thought patterns. You had that list of common cognitive distortions. Can you tell us more about those?
Yeah, so these distortions are basically these sneaky little traps that our minds can fall into. They're these ways of thinking that aren't really accurate, but they can fuel negative emotions and keep us stuck in a depressed mood.
Okay, so give us some examples.
Sure. So there's arbitrary inference, which is basically jumping to conclusions without enough evidence.
Like assuming the worst?
Exactly. And then there's selective abstraction, which is when you only focus on the negative stuff and ignore the positive.
Like a mental filter.
Yeah, exactly.
Wow.
And dichotomous thinking, that's black and white thinking, seeing things in extremes.
Like all or nothing.
Right. And overgeneralization, that's when you take one bad experience and apply it to everything.
Oh, I do that one.
We all do it sometimes.
Yeah.
And then there's personalization, which is blaming yourself for things that aren't actually your fault.
Right, taking on too much responsibility.
And magnification and minimization, that's making a big deal out of negative things and downplaying the positive.
Okay, that's a good one to watch out for.
And catastrophizing, that's always expecting the worst possible outcome. And then there's negative imperatives, which are all those shoulds and musts that we put on ourselves.
Yeah, those can be really harsh.
They are. And all these distortions create this kind of negative filter through which we see the world.
It's like looking through gray-tinted glasses.
Exactly. And that makes it really hard to see things clearly and feel hopeful.
So how does CBT help people recognize and challenge those distortions?
One of the most important tools is the daily thought record, or DTR. It's basically a way to write down those automatic negative thoughts.
Oh, okay, like journaling.
Sort of, but it's more structured. You write down the situation, the thought, the emotions you felt, and then you rate the intensity of both the emotion and how much you believe the thought.
And why is writing it down helpful?
Because it brings those thoughts out of the shadows, makes them more concrete so you can actually examine them. And then the therapist helps you question the evidence, explore other perspectives, and think about the consequences of holding on to that thought.
It's about becoming more aware of your thought patterns.
Exactly. And for older adults, it can be really helpful to draw on their past experiences. They've lived through a lot, they've overcome challenges, so we can tap into that resilience.
Oh, that's a good point. Their life experience can be a real asset.
Absolutely.
You also talked about core beliefs. What are those?
So core beliefs are these really fundamental beliefs we have about ourselves, other people, and the world. They're often unconscious, and they tend to be very rigid and global.
Okay, give us some examples.
Sure, like I am unlovable, or the world is dangerous, or I am incompetent.
Those are pretty heavy.
They are. And the idea is that those core beliefs drive a lot of our automatic negative thoughts.
So it's like an iceberg, right?
Yeah.
The negative thoughts are just the tip, and the core beliefs are underneath.
Exactly. And to get to those core beliefs, we use a technique called the downward arrow technique. It's basically about asking, what would that mean to you? Or why is that upsetting? Until you get to the root of it.
So it's like peeling back the layers.
Yeah, exactly.
And once you identify those core beliefs, how do you change them?
So changing core beliefs, that's the deep work. And it takes time. It's not a quick fix. It's about understanding where those beliefs came from, looking at the evidence for and against them throughout your life. And it's important to set realistic goals.
So you're not going to go from I'm bad to I'm perfect overnight.
Exactly. A more realistic goal might be to shift towards something like, I'm a flawed human being just like everyone else.
Okay, that makes sense.
And there are techniques that can help with this. Behavioral experiments are great because they allow you to test out your beliefs in the real world and see if they hold up.
So you're gathering evidence.
Exactly. And there's this other technique called the continuum method, which is basically about identifying a continuum between the negative belief and a more positive adaptive belief.
Okay.
And then you start looking for even small pieces of evidence that support moving towards the positive end.
Like if you believe you're completely unlovable, you might start noticing small acts of kindness from others.
Exactly. And that can start to chip away at that core belief.
Okay, so we've talked a lot about depression. Now let's talk about anxiety, worry, and panic disorder in older adults.
Yeah, anxiety is a huge issue too. And while some types of anxiety, like panic disorder and OCD, might be less common in the old GAD, generalized anxiety disorder, and phobias are pretty prevalent.
And I think we tend to associate phobias with younger people, but they can develop later in life too.
Absolutely. And agoraphobia, which is the fear of open spaces or crowds, that can be particularly impactful for older adults.
Yeah, because it can really limit their independence.
Exactly. So research shows that a good chunk of older adults experience some kind of anxiety disorder, and just like in younger people, women tend to be more affected than men. What's interesting is that some studies suggest that GAD might actually be more common than major depression in people over 65, and it might even increase more after 75. But there's also this contradictory finding that in some outpatient settings, older adults don't report that much worry.
Really?
Yeah, which might mean that they've just gotten really good at coping with it over time.
Okay, that's encouraging.
It is. But it also highlights the importance of using assessment tools that are specifically designed for older adults because anxiety can manifest differently in later life.
Right, the standard scales might not be appropriate.
Exactly. They might not capture the nuances of how older adults experience and express anxiety.
Okay, so what about assessing specific types of anxiety, like phobias? You mentioned agoraphobia before. How does CBT approach that?
So with phobias, especially those that develop later in life, it's really helpful to understand what triggered them. Like, was there a specific event that brought it on?
Okay, give us an example.
So let's say there's a 70-year-old woman, Mrs. D, who develops agoraphobia, specifically a fear of using public transportation. And it turns out that it started after she had this really embarrassing incident where she couldn't find a toilet in time while on a bus.
Oh, no.
So now she's got all these intrusive thoughts, like, what if it happens again? And she starts developing safety behaviors, like excessively planning routes with restrooms, avoiding situations where she can't easily access one.
Which, ironically, just makes the fear worse in the long run.
Exactly. Those safety behaviors maintain the phobia. So CBT for agoraphobia would involve a few things. First, we educate her about anxiety, how it works, what's happening in her brain and body.
Yeah.
Then we work together to create this graded hierarchy of her feared situations.
Like a step-by-step plan.
Exactly. And then we use exposure therapy, which is basically about gradually confronting those fears in a controlled way.
So starting with something small and manageable.
Exactly. And throughout the process, we're also using cognitive restructuring to challenge those anxious thoughts and help her reduce her reliance on those safety behaviors.
So it's a multi-pronged approach. What about panic disorder and GAD? How does CBT work for those?
So for panic disorder, there's this model developed by David Clark that focuses on the idea that panic attacks are triggered by this catastrophic misinterpretation of bodily sensations.
Okay, so it's like your body's having a normal reaction, like a racing heart, but you interpret it as something dangerous.
Exactly. And that ramps up the fear even more. And then you become hypervigilant, constantly scanning your body for signs of danger. And then you start using safety behaviors to prevent the perceived catastrophe, and you avoid situations that you associate with panic.
It's a vicious cycle.
It is. And for GD, the core issue is this uncontrollable worry that just seems to take over. And there's this model by Adrian Wells that distinguishes between two types of worry. Type 1 worry is about external events like finances or health.
Okay, the stuff we all worry about sometimes.
Right. But then there's type 2 worry, which is worry about worry.
Like worrying that you're worrying too much.
Exactly. It's this meta worry, the belief that worrying is bad for you or that you can't control it. And that just fuels the anxiety even more.